Thank you so much for that warm introduction. My name is Christian Lawson, and I am excited to share my journey with living with a chronic disease. I would like to thank the American Board of Pediatrics and the American Academy of Pediatrics for this incredible opportunity to share my story with you all today. I would also like to thank each of you healthcare providers for your hard work and leadership over the past few months of this pandemic. You all have been leading out this continuous call and conversation for Black Lives Matter and healthcare inequality. I am honored to share my story with you all today and to contribute to the work of making healthcare better. My story begins in 2008 after a bike accident at my aunt's house. She has a series of small hills in her backyard. One day after I went over one of these hills, I lost control of my bike. I broke several bones in my right arm and left leg. But there was more than just broken bones wrong with me. It wasn't until several months later that, after many tests and procedures, I was diagnosed with Crohn's disease. Crohn's disease is a chronic condition that causes inflammation and irritation along the linings of the digestive tract. Inflammatory bowel disease can occur at any age. The peak time for diagnosis is in between the ages of 15 and 25 years old. It is estimated that 80,000 children in the US have IBD. When IBD is diagnosed at an early age, it can cause a very hard time with understanding and following a very severe healthcare plan than when diagnosed in adulthood. I've learned that Crohn's disease cannot be cured, but with the help of medications, the disease can go into remission. My GI doctor told me that he would put me on some medications to see what would work best for me. Little did I know that I would spend most of my time as an 8-year-old Black boy in doctors' offices trying to figure out what caused the stomach pain, loss of appetite, and weight loss I experienced a few weeks after my bike accident. My family and I had so many questions as to why one bike accident could lead to digestive issues. My primary care doctor could not provide an explanation to me of what was wrong. Maybe he had never seen something like this before. No one around us could tell us exactly what Crohn's disease was or how it affects people. And after a while of trying several medications, nothing seemed to help. No care provider ever asked me about my emotional health, how I was doing, what I was thinking, or how I was handling what was happening right before my very eyes. I was told that a lot of Black people don't have this disease, and I thought that I was the only one experiencing this terrible disease. I was often told by people in my community that you've got to get through this. Hold your head up and keep the faith. After a while, my disease had gotten so bad that I began to turn inward. I became quiet about my pain and wanted to be left alone. I lay prostrate on the floor sometimes, crying in pain, hoping and keeping my beliefs that one day I would see a day without pain. Some days that mindset turned from days without pain turned into hoping that someone would kill me or thoughts of killing myself. I felt alone and I didn't know who to trust. Even now, it's tough for me to manage this disease. I still don't know how to talk about this disease with people within my community and my care provider team. I don't know how to have these difficult conversations, but I'm learning. I'm working with a therapist. And it has been very challenging and hard for me to see my parents agonizing over my condition in the past and even now. I would like to invite you to imagine with me the struggle of a young Black patient who is living with Crohn's disease. Think about traveling 3 hours to see the doctor. Think about sitting in the waiting room and not seeing anyone who looked like you, waiting to see the doctor. Think about the doctor and the nursing staff not really looking like you. Think about the pain and the grief of the frustrated Black parents who cannot understand what's going on with their child. Think about the financial and other constraints that these parents must struggle with, the toll of taking care of a sick child and raising another healthy child. Think about the teenager with an NG tube taped to their cheek. Think about the looks that this teenager must get when they're out in public. Think about the social aspects of explaining why you have an NG tube, what a chronic condition is, and why you are fatigued every day. You have just come out of part of my story with Crohn's disease. My story has several parts: Crohn's disease, the emotional aspects of living with a chronic disease, and the impact of being Black in our healthcare system. Despite these challenges I have faced, I've grown from my struggles, learning with chronic illness. I am strong. I am brave. I am strong. I have had the privilege of working with several organizations such as Improve Care Now and the Crohn's and Colitis Foundation. In each of these organizations, I have made relationships with other patients who have IBD. To hear their stories and their struggles have encouraged me during difficult times. Improve Care Now is a learning network that is made up of care providers, patients, and parents across the globe who work together to improve IBD healthcare. I am a member of the Patient Advisory Council, and we create resources that help other patients with IBD. For example, the Ostomy Toolkit for patients with ostomies, transitioning to adult care, or moving to college. We also advocate for other patients with IBD. I am also a member of the network's Diversity, Ethnicity, and Inclusion Committee within Improve Care Now. With the continued conversation about racial inequality in the world, I share my story with you all, not for your sympathy or to point a finger at anyone. I share my story with you all to encourage each of you. You can become the change when it comes to racial and ethnic relationships within healthcare. Create safe spaces for your families that you treat. Having magazines, coloring books, and posters that are geared towards the minority families in your clinic. Don't be afraid to ask minority patients and their families, how are you? How are things going? Has anything exciting happened to you all lately? Are there any questions you all have? During difficult times like these, when stories like George Floyd murder is always in the news, acknowledge that this must be a tough time for you as a Black or a minority within society to the patients that you treat. Create vulnerable communication with your patients and their family is important. I know you're busy and I know that you have so much to do at the clinic, but take time to ask your patients about their emotional health and listen is so important. You might not be of the same demographic as your patient that you treat or engage with, but building a trusting relationship will help your patient's healthcare experience while boosting their overall mental health. In doing this, your patient will become fully transparent with you about how they feel, what's happening in their personal life, and how it affects their physical health. It is important to let your patient know how much you care. Diversify your healthcare team if you can. I remember shortly after being diagnosed, meeting 2 minority research coordinators. I was scared and I did not know what was happening. And they could see how afraid I was. They comforted me and my mom, and their kindness towards me and my family has always stayed with me. If you cannot diversify your healthcare team, find a fellow or colleague that is a minority and talk about some of the struggles we face and how to approach our care. The AAP has develop modules on fighting racism. The ABP has a roadmap project to help clinicians care for emotional health of their patients with chronic conditions who are minorities. There are so many resources, including a video on the impact of being Black on living with a chronic condition. The ABP provides mock Part 2 credit for DEI learning. A Part 4 credit will be launched this month. So take some time and learn and grow from them. They will really help. In closing, I would like to thank my family. They have been my strength over these long, difficult years and have motivated me to keep pressing forward. I would like to say thank you to each of you care providers for your hard work and leadership. I will never forget the care provider team that came together during my 4th hospital stay. They put their hands and arms together and created a bridge for me and my mom to exit the hospital one very last time. This is a reminder that together we can bridge the gap in healthcare inequality and care for minorities. We are better together. Thank you so much.